From the Gulf States newsroom, this is the Gulf States Gumbo, your weekly serving of stories from Alabama, Mississippi, and Louisiana. I'm economic mobility reporter Stephan Bisaha, chopping it up this week. On today's show, we look at three of the scariest words in all of medicine: out of network.
I started crying. I hung up on her. I had to go sit outside, and I said, I do not understand what has just happened.
And we look at attempts to keep down health costs at the national level. But cuts in life-saving research could come with their own costs for both patients and Alabama. That's all coming up on the Gulf States Gumbo. All right, so for today's show, I got with me my colleague and public health reporter, Drew Hawkins. Drew, always great to share a mic with you.
It really is, Stephen. Thanks for having me here.
So President Trump and Elon Musk and the Department of Government Efficiency, or DOGE as it's called, has been dominating the news lately. But before that, health insurance issues, that was a dominant issue in the news.
Yeah, it was kind of this phenomenon, right? We're definitely in very deeply divided times, but health insurance and bills and the frustrations around that, I feel like that's something that's really agreed upon by many Americans.
Yeah, and particularly about how these health insurance issues can lead to medical debt, which, could be absolutely crippling. And I know you've been reporting on this with one family that's done everything possible to avoid getting stuck in that debt.
Exactly. That's exactly what happened.
Yeah, and I'm always curious, how did you end up finding this story?
Yeah, I got this one on Reddit. I posted on a page called Health Insurance, and I got a call from the Malash family in Mississippi, and they told me their struggles trying to get this life-saving care. And I knew right away that it wasn't your typical health insurance denial story. So I hopped in the car and I drove to Mississippi to meet with them.
Hello.
How you doing? What can I help you with?
Trevor Malash, his mom Tracy, and his dad Charles run a small business in a small town on the Mississippi Gulf Coast called Ocean Springs. They started it after Charles retired, and the business was their dream. It allowed a change of pace for Tracy, who spent years working as a nurse in Mississippi hospitals. They could spend more time together as a family.
We did not know all of the other things that came along with it, as far as losing really good insurance and, things of that sort.
The business also allowed the Malashes to purchase medical insurance for Trevor on the Mississippi marketplace from a company called Molina Healthcare, which he needed. Trevor was born with a condition called aortic stenosis, sometimes called a failing heart valve. When he was a kid, he had surgery to replace one of the valves. He's 28 now, and last summer, he started having problems again. He started feeling weaker, more tired, so he went to his doctor.
I knew this was coming up. I knew it was going to happen. Did I know it was going to happen this year? Absolutely not. I had no idea until I'd had the checkup.
This is when their troubles began. Trevor needed a new heart valve, an operation that can cost hundreds of thousands of dollars, and his doctor recommended a surgeon at Ochsner Health in Louisiana. But Ochsner isn't part of Molina's network. Trevor's secret weapon, his mom, who was a nurse, knew it would be a fight to get the surgery approved. After Molina denied the surgery multiple times, Trevor went to a surgeon that is in Molina's network in Mississippi. But in a letter to Molina, the surgeon said the operation was, quote, beyond their scope.
We believe it is in the patient's best interest to receive treatment at a facility with a higher level of care.
Hospitals and insurance companies have their own conversations where they work out getting procedures approved. The Malash family made themselves part of these backroom dealings, calling Ochsner and Molina almost every day.
We did get a lot of backlash from my mom making phone calls. And I don't know, I'm lucky in that regards. I have a mom with a medical background that's been in the hospitals. Not everyone has that. So I'm definitely going to let her help me in this. I'm not going to try to do this alone.
Eventually, after weeks of phone calls, they got one they'd been waiting for from the insurance company.
Everything's been approved. You're going to get white glove service. Exact quote. Awesome. Oh my God, I'm crying. I don't know what to do. I'm calling everybody. We've been approved. It's on. We're going to get it. Now we just got to get a date.
Molina approved the surgery through what's called a single case agreement, basically a contract between an insurance company and an out-of-network hospital. The family contacted Ochsner to let them know. Then they got another phone call, this time from the hospital.
Due to the stress on our team, We have decided not to move forward with Trevor's surgery. And I just sat there I was like, what? Like 3 months of work? We've all of us have been working on what? And you can tell I started crying. I used the F word. I hung up on her. I came out of here. I had to go sit outside and I said, I do not understand what has just happened. I do not understand this at all.
The Malashes reached out to the Mississippi Insurance Department for help. They say they were told to find a provider in Melina's network who could perform the procedure to start the process over again. Experts say that what the Malash family is experiencing is not uncommon. Melina's narrow network, the list of providers approved by the company, is part of the problem here. Ruth Londe is with Undue Medical Debt, a nonprofit that works with people struggling with medical bills.
So the fact that they did all that incredibly hard work, that didn't surprise me. They got it. Fantastic.
Londe says what stands out to her in this case is the hospital refusing to do the surgery after Melina approved it. She says she actually yelped when she reviewed the records for this story.
And then I was shocked that the surgeon didn't agree to go ahead with the surgery. I don't understand that at all. That's bizarre. I don't get it.
Ochsner and Melina did not respond to questions for this story, so there's no way to know exactly what happened in their conversations. But at the beginning of the year, Trevor switched insurance companies, and they've had to start the process all over, finding a heart surgeon the insurance company will approve. It's now February, and he's still waiting.
You can read more Drew's reporting and about the Malashes if you go to wwno.org or follow the link in our show notes if you're listening to the podcast. And, Drew, we've done a lot of stories on bills over the year. Like, particularly we did a lot on utility bills in the Gulf South. And the NPR's had their own healthcare bill of the month series going on for years. Yours is about someone who's, done everything to avoid getting in that spot of being the healthcare bill of the month. And they still got stuck in this terrible situation. So I think the thing I really want to ask is just, what the hell, man?
I mean, I feel like that's a fair question. As I mentioned how this isn't this typical crazy health insurance denial story. In this case, I think it's something that may be more familiar to a lot of people, and that's these dreaded words, out of network.
Yeah, that's like the boogeyman phrase when it comes to health insurance.
Oh, yeah. They're the three worst words that you want to hear, especially if you need life-saving medical care. At the end of the day, like so many other things, it's really all about money, whether that's medical bills or even funding the research that goes into these medical treatments. And I know that's something that you've also been looking at too, right, Stephen?
Yeah, I've been a little bit busy lately covering a lot of this stuff that's going on with the NIH funding cuts that's being discussed or proposed.
Yeah, let's just explain what NIH funding is.
Yeah, so this is the National Institutes of Health, and they're basically the funding arm of the government as far as giving grants to different institutions that do health research into things like cancer and other life-threatening diseases.
Why is it so much in the news right now?
Okay, first, two quick disclaimers, because, with anything in the Trump administration, things can change very quickly. So we are recording this on Wednesday. Things might change by the time you hear this. And the other thing is the University of Alabama at Birmingham oversees the Gulf States newsroom, which, again, that's this newsroom, the one that you and me, Drew, we work for. But our news and the business departments for UAB, they operate independently from each other. So back to the NIH, there was these plans announced February 7th. The NIH sends out this memo. It basically says, billions are going to be cut from NIH funding, including tens of millions that would be going to Alabama.
All right, so billions, millions, a lot of money, big numbers. But what does this mean for research? I mean, are we not going to find the cure for cancer?
Well, I'm so hopeful on that cure. But UAB said in a statement that this would cause a direct slowdown into life-saving research, again, into things like cancer, stroke, heart disease. Here's Birmingham Mayor Randall Woodfin talking to me shortly after the cuts were announced.
What's happened over the years with billions of dollars in research has literally saved lives.
And Woodfin is a Democratic mayor. What are Republicans saying?
Yeah, so Alabama, we have two Republican senators. One of them is Katie Britt, and she sent out a statement that kind of walks this very fine line. She kind of threads the needle as far as she's not coming across as criticizing Trump administration. She says, yes, I agree with you. We need to cut administrative bloat. Also, we need to be careful with this, that we're not threatening life-saving research. And, we don't want to lose our edge against China and all that. Like, I'm happy to work with y'all guys and Robert F. Kennedy at Health and Human Services to make sure that we're doing these cuts effectively.
Okay, so we could see some impacts as far as public health goes, but you're the economic mobility reporter. What is the economic impact here?
We do know it would certainly mean lost jobs. And again, I should say, this cut has actually been frozen by this federal judge. It's not actually going through right now while this gets worked out in the courts. But if these do go through, it would definitely mean lost jobs. Birmingham's reliance on biomedical research is really hard to overstate. It came after the steel industry the city was built on collapsed in the 70s and 80s. And the tens of millions of dollars that could be lost here would be felt well beyond UAB's labs. All right, Drew, now before you go, it is my turn to turn things back around on you, and it is time to talk about Gulf States gems.
Okay, all right. What you got?
Well, this week I want to talk about libraries. For me, a good library is this kind of bastion of comfort and knowledge, which, I kind of feel like I could use a little bit of that right now.
Oh, that's no problem. I can talk libraries for days. I was actually at my library this past weekend for our short story club meeting. So that's not a problem with me. But first, since you brought this up, let me hear yours.
Yeah, so this library that I particularly love is called Library in the Forest in Vestavia Hills, which is kind of this kind of well-off suburb in near Birmingham. And it's got these gorgeous giant windows that look out over these beautiful woods that you can, take a reading or work break and actually start walking through them and go on a hike. They got these lovely fireplaces you could sit at. And, I spent the weekend working on a podcast there. And, if you're going to be working on a Saturday, it's a pretty nice place to do it.
Yeah, I mean, that sounds really great. You're in this idyllic library nestled in the woods.
Yeah. Also caught up with one of the book club reading that I'm behind on.
Yeah, I think you're in too many book clubs at this point.
Yeah.
On the other side of things, I would say my community library, right in the middle of New Orleans in Algiers Point, the neighborhood we live in. It's called Ceta Dennis Hubble Branch. It's named after Ceta Hubble, who was a neighbor of ours before she passed away. And she and her husband really led the charge to get the library reopened after it closed in 2005 after Hurricane Katrina. Reopened in 2013. I was at that ceremony. I brought my daughter, who was just a baby then, and we got some books signed to her. And we're there all the time now. And I think one of the biggest advantages of having a library around the corner is I can request any book in the system and have it just delivered to my library. In fact, my daughter is old enough now that she can just go pick them up. I can send her to pick them up for me now. So
from being your accompaniment for a book signing to now being your courier for picking up books.
She's our book runner, and she loves that job too.
All right, Drew, I wish you a relaxed weekend and some lovely library reading time.
I wish that for me too. And I also wish it for you, Stephen.
All right, both of us. We'll get this shared together in our respective cities. This week's Gulf States Gumbo was produced by me, Stephan Bisaha. Our head chef this week is Tyler Pratt. Our theme music is by DJ Supreme. Special thanks to our partner stations WBHM, Mississippi Public Broadcasting, WWNO, and WRKF. You can find us in your podcast feeds every Friday. Look us up and be sure to subscribe. Thanks for listening, and don't forget to stir your root.